Hey, Andy Stroman here. What I'd like to do in this video is walk you through my guide for people who are starting Medicare or maybe helping someone who is starting Medicare. This is the deep dive version. If you're one of those types who likes to go deep on a subject and really research things, this guide is for you. I did not shy away from length. It's got every detail that I think is important or that you may want to know when starting Medicare. So just to give you a quick intro about the document, nothing too fancy. Table of contents here will take you where you want to go. These links are jump links, so if you click it, it'll take you to the page with a specific section where it says it is. We're going to start with a little bit of background info about the Medicare program. Nothing too crazy, but just enough to kind of level set. So, what is Medicare? It is health insurance. Plain and simple. It is federally funded and sponsored health insurance. A lot of people think it's something to dread, or it's like a sign of getting older, and it's something to frown about. I understand that sentiment, but I would offer this: Medicare is the best health insurance you can get in the United States, and it's not even close. So, if you ask me, that overcomes any sort of negative sentiment about it, at least as a beneficiary of it. So who is eligible for Medicare? Who is it for? It's primarily for people who are age 65 and older. So if you're a U.S. citizen or you've been a legal permanent resident here for at least 5 years and you are 65 or older, you are eligible to enroll in Medicare. The second category of people who can get Medicare are people who are under 65 who have been receiving Social Security disability benefits for at least 24 months. So sometimes you're on and off Social Security disability. It doesn't have to be consecutive, but if it's at least 24 months cumulative that you've gotten those benefits, starting on that 25th month, you are eligible for Medicare. And again, that is regardless of your age. The two other categories of people who are eligible for Medicare are people with ESRD, which is end-stage renal disease or kidney failure, and the last category, people with ALS, also known as Lou Gehrig's disease. You are eligible for Medicare. Some misconceptions about Medicare. Let's kind of debunk these. The first, a lot of people think Medicare is entirely free. And I can understand where that comes from because you pay into it with every paycheck throughout your whole working career. It's free to an extent. So what you pay toward Medicare during your working years goes to Medicare Part A. And Medicare Part A is only part of the equation with Medicare. So for most people, it is going to be free. But Part B and all the other components of Medicare that you're going to want to add to complete your coverage are going to cost money in most cases. So Part B, and we'll get into the parts in a second, is at least $174.70 per month. That's the 2024 rate. It goes up 3 to 5% a year. That number will increase if you are what Medicare classifies as a high earner in certain income brackets. There are deductibles and coinsurance that you need to factor in as well, but there are ways to eliminate or mitigate those. So Medicare is not entirely free. The second misconception: the government will notify you when it's time to enroll. That is not the case. You will get a ton of marketing material sent to your door, on the phone, online. I wish I could do something to stop that. So needless to say, you're not going to forget that your 65th birthday is coming up, but the government is not going to remind you and give you, a huge set of instructions. If you are receiving Social Security retirement benefits, however, before age 65, then you're going to be enrolled in Medicare Part A and Part B automatically at age 65. So that's kind of the one exception. And not many people are in that situation, but something to know. So it's, bottom line, your responsibility to enroll when you are ready. The third misconception I want to touch on, this is probably the biggest one, and that is, hey, if I'm 65, I'm turning 65, and I'm still going to work, I'm going to work well past 65, let's say, then I don't need to worry about Medicare. I'll just put it off until I retire. That seems to be the conventional wisdom. And in many cases, that's okay. But here's why I wouldn't do that. First, some people need to enroll at age 65 if they work for a small employer. Some people are better off going to Medicare and dropping their group health insurance at age 65. And so you need to do that exercise, do that research, crunch the numbers a little bit to see if you need to take action at age 65. Don't just let age 65 come and go and not do anything. Last thing in this section, just to cover the basics of Medicare, Medicare versus Medicaid. A lot of people get this mixed up. It's understandable, very similar. They're government health insurance programs. The easy way to decipher these, Medicaid is more akin to financial aid. So it is needs-based, regardless of age. If you have a certain income or lower than that, certain assets or lower than that, you may be eligible for Medicaid, which is at the state level. Medicare is age-based, so age 65 with a couple of exceptions that we've covered. And yes, some people do qualify for both, and the term for that is dual eligible. But Medicare is age-based, Medicaid is financial needs-based. The next section of the guide is the parts of Medicare. And we're going to go somewhat in order, but just bear with me, follow through this with me. It'll all come full circle. We're going to start with Part A and Part B. So that seems logical, right? Part A and Part B, when you combine those two coverages, you get what's called original Medicare, sometimes called traditional Medicare. The reason it's called that is because back in 1965, when the program started, that was the extent of Medicare. It was Part A and Part B, and that was it. And back in the day, that was enough. Not so much the case anymore. So let's go into each of these parts. Part A is something called hospital insurance. Part B is called medical insurance. And that doesn't really make much sense. Like medical insurance is medical insurance, right? But Medicare splits those two as far as their definition of it goes. Part A, hospital insurance, think of that as anything inpatient related. So when you're admitted to a hospital, Part A is what primarily pays for that or covers that. So the inpatient hospital stay itself, so like the room and board in the hospital, hospice care, some home health care, and then in some circumstances and for a limited time, skilled nursing care. That is Part A. So the services of nurses, the room and board of a hospital, think of that as Part A. And that seems like just a little bit of the puzzle of your overall healthcare picture, but they're expensive when you need them. So Part A covers quite a bit, even though the list is kind of small. Part B is medical insurance. So think of this as your everyday uses, anything outside of a hospital that is a healthcare professional. Outpatient medical services, even though you may get those services in a hospital, if it's technically outpatient, it's covered under Part B. So things like your regular doctor's office visits, your annual physical, your well women's visits, vaccines, lab work, x-rays, MRIs, drugs that are administered by a healthcare professional, so not a prescription drug that you pick up at a pharmacy, but something like an infusion that a doctor or nurse or physician's assistant has to give, that's covered under Part B. Clinical research, ambulance services, and the last category is durable medical equipment like wheelchairs, walkers, commodes, blood sugar meters, insulin equipment, stuff like that. So you can start to see that when you combine these two, as far as when you need help from a medical professional when it comes to your health care, Part A and Part B are going to cover the vast majority of what your needs are. And so it's comprehensive for sure. Prescription drugs are notably missing from here, right? That is something that was added on as the program aged, and that is actually Part D, which we'll touch on in a second. Part C comes next in the alphabet, so I'm going to cover it very quickly. It's just another term for something called Medicare Advantage. It is not mandatory, it is optional. A lot of people think, well, I got Part A, I got Part B, now I need to get Part C, right? Not the case. It is optional. We'll dive into this a little bit more in the guide. but I just wanted to mention that before we jump to Part D, which is prescription drug coverage. So in the early 2000s, this was introduced because, as I'm sure has been your experience as time has gone on, prescription drugs are more and more the interaction with the healthcare system, I should say, that we have the most. Think about it. If you are on a medication, you're filling it every month. You may go to the doctor once every 3 months or once every 6 months, something like that. When you use your health insurance or think about health insurance, prescription drugs are probably at the top of the list as far as frequency goes. So prescription drug coverage was added in the early 2000s. It has been, let's say, an overly complicated part of Medicare. It is very hard to understand. It's way too convoluted. Let me just say that starting in 2025, it is becoming as simple as it should have been from the start. So as I record this, it is 2024. But if you are starting Medicare from my point of recording this onward, most likely you're going to be starting in 2025. So I'm not going to get into the depths of how it is currently structured. Basically, the way to think about this is when you look for Part D coverage, you need to find whatever coverage is going to give you the drugs that you take at the lowest total cost. So 12 months of the supply of the medication. For every medication you have, which plan gives you the lowest cost to get those through the plan? That's how to choose the right Part D coverage for you. The way you need to buy or procure Part D coverage, and you do need it, whether you take prescription drugs or not, you can buy it on its own, or if you go with Medicare Advantage as your coverage option, you need to buy a plan in most cases that has Part D included in it. There are some exceptions, like if you have TRICARE or military benefits or federal benefits. But for most people, if you buy a Medicare Advantage plan, you need to get one with Part D included because you can't mix and match. If you go with original Medicare with a Medicare supplement, which we will touch on here in a second, then you can buy and need to buy Part D on a standalone basis. So with that said, those are the main 4 parts of Medicare, just an introduction to them. Really, the way to think about this is not keeping in mind and committing to memory the different parts and what they mean. It's really a combination of certain combinations of those that you need to keep in mind. But the basic point is Part A and Part B alone are not enough coverage. That used to be enough, but it is not anymore. Essentially, and I'm generalizing here, but it's enough to prove the point. Part A and Part B alone are going to pay about 80% of your major medical expenses. Now, it covers all those services that we touched on, but it doesn't pay for it or cover it at 100% of the cost. You are on the hook for, generally speaking, about 20% of the cost, and there is no limit to that cost, which is the big kicker. So, if you are diagnosed with cancer or something else that is as serious, or you get sick, have a long hospital stay, claims for that can reach $1 million plus, at least six figures, pretty quickly and pretty easily. It happens all the time. And you don't want to be on the hook for 20% of that with no limit on your cost exposure. At least no one that I have met would be comfortable with that, regardless of means. So in order to address that, really what you do is you get either a Medicare supplement plan or a Medicare Advantage plan. Those are the 2 routes of coverage. There's no right or wrong answer. Generally, for some people, a Medicare supplement's the right move. For some people, Medicare Advantage is the right move. So you can forget everything that I've said so far, and you'll be okay. Because in the real world, the practical application of all the parts of Medicare is this. You're going to choose between one of 2 options. And I touched on it a second ago. But option 1 is keeping original Medicare, that Part A and Part B, adding a Medigap plan or a Medicare supplement plan, that means the same thing, and adding Part D prescription drug coverage. So you're combining those, there are really 4 components, that Part A, Part B, Medigap, and Part D. This is the higher priced of the 2 options, but you get what you pay for. You keep original Medicare, like I said, so the government is your health insurance, and there are benefits to that. In a nutshell, for $300 to $350 a month more if you are a high earner, you can get health insurance coverage with, get this, 0 network restrictions. You can see any doctor in the US that accepts Medicare, which is like 98% of them. No need for a prior authorization to see a specialist. You don't need to get referrals. There's an annual out-of-pocket maximum, which is the same number as your deductible in this situation, for just $240. And that is all you're coming out of pocket for medical expenses, which is absurdly low compared to how other health insurance works in this country. Now, prescription drugs are a separate calculation, but that will be capped at, in 2025, starting in 2025, a maximum of $2,000 a year, which, unless you're taking something that's like a name brand expensive drug, you're not really going to touch. So this is excellent coverage. If you have the means, this is the way to go, in my opinion, in most cases. You need to purchase, again, the Part D prescription drug plan separately. And if you want dental and vision insurance, you do need to purchase that separately as well. So you can see this is very much a customizable mix and match, kind of build your own package. And it is more expensive, but it is the ultimate version of health insurance that you can get in the United States. Option 2 is Medicare Advantage, also called Part C. Most people call it Medicare Advantage. The way this works, technically speaking, if you go with Medicare Advantage, you are trading in original Medicare for the plan that you choose, which is from a private insurance company. So quite literally, the government takes your record and transfers it to an insurance company. It's no longer risk on the government's books. It's about half the cost of option 1, which is the Medicare supplement or Medigap option. It's more of a pay-as-you-go plan. So on a monthly basis, the plan itself is less expensive, but when you use health insurance when you use medical services, healthcare services, you're going to pay more for your share of those things, again, as you use them in the way of copays and coinsurance. There's going to be a copay for pretty much everything. The one thing to keep in mind is your out-of-pocket maximum can be as high as about $9,000 a year. Now, most plans are a little bit lower than that, but it's still several $1,000s if you have a lot of needs for healthcare. If you use a lot of healthcare, if you have a hospital stay, you're probably going to reach that number or get close to it. So that's something to budget for and keep in mind. Now, it's still excellent coverage compared to the health insurance you're probably used to. I don't mean to demean it, but compared to option 1, the Medigap option, from a coverage perspective, it is inferior. Now, back on the positive side of Medicare Advantage, most do include prescription drug coverage, and I recommend in most cases getting a plan with drug coverage if you go this Medicare Advantage route. And most also do include some form of dental and vision coverage. It's not going to be stellar, but it is going to be enough to cover like routine cleanings, exams, stuff like that. So you can't buy a separate Part D coverage if you go with Medicare Advantage. If you go Medicare Advantage, you gotta get drug coverage with that plan or go without it. So you can't mix and match the medical and the prescription side on the Medicare Advantage option. So that was a lot of nitty gritty explaining each of those two options. Let's zoom out and look at the decision to make. How do you choose between these if you don't already kind of have an idea? So let's put it simply, Medigap plans, that's the premium option, the Cadillac option, if you like. Medicare Advantage is the more affordable option for the plan itself. So Medicare Advantage plans are also called MA or MAPD plans, just FYI. No monthly fee in most cases. They have higher costs when you do use healthcare services. Think of just pay as you go. And there's more variability, of course, because some years you may not, go to the doctor much at all, may not have any hospital visits, but some years you might. And in those years, you might very well hit that out-of-pocket maximum of several $1,000s. With the Medigap option, No matter what happens, you're paying a couple $100 out of pocket, no matter what happens, like I said, and you are done after the first couple $100, with the exception of prescription drugs. But prescription drugs are a separate equation for Medicare as well. So with Advantage plans, you've got co-pays for pretty much everything. Doctor appointments, hospital stays, scans, lab tests. A Medigap plan, if you go with Plan G, which is a type of Medigap plan, it's the most popular one. In 2024, you've got a $240 medical deductible. Full coverage beyond that for all expenses that are covered by Medicare. As we've touched on, Medigap plans, you keep original Medicare. One of the bigger perks of that is you have the flexibility to visit any healthcare provider in the country who accepts Medicare. There are no network restrictions. There's no in-network, out-of-network. As long as the provider accepts Medicare, which again is darn near all of them, you can go. Medicare Advantage plans do have networks. Some are HMOs, some are PPOs. HMOs, basically you have to stay in the network. There is zero coverage outside of the network of doctors and facilities. With PPO plans, you do have the option to see out-of-network providers, but your cost for that is going to be much more than if you stay in network, usually at least double. So point is, you need to stay in network, whether you have an HMO type plan or a PPO type plan as a Medicare Advantage plan. One last thing to consider is stability of the plan itself. So Medicare Advantage plans can and usually do change every single year as far as the benefits go, as far as your share of costs go, how much the copays are, how much the out-of-pocket maximum is. And importantly, doctors and hospitals can leave and join networks or certain plans on a yearly basis as well. So you can change plans every year under Medicare Advantage, but it's work to do that, and you're probably going to need to do that to serve your best interests. So just something to be aware of. With Medigap, it is much more stable. These plans do not change. They haven't changed in decades. The price will go up like anything else, but the benefits themselves, the whole network restriction thing, not a factor with Medigap. So, this is a table here. If you prefer to just do a side-by-side, I'll read through these points really quick. I may be repeating myself, but I think that's okay at this juncture. On the left side is option 1, original Medicare with Medigap or a supplement, and Part D coverage. That's the combination I recommend and what you should have if you go this route. Higher monthly premiums for the plan itself, low or no copays, no coinsurance, a very small deductible. You can go to any doctor that accepts Medicare, which is darn near every single one of them. No prior authorizations to deal with, no referrals to deal with. You do need to buy a separate Medicare Part D plan, but you can't see that as a positive because you can kind of mix and match the exact plan that is right for you. It doesn't come with extras like dental or vision coverage, no extra perks usually, so just be aware of that. You need to buy that separately if you want it. The plans do not change from year to year, and rate increases usually 3 to 8% is what you should expect. Goes up with the cost of pretty much everything. So nothing out of the ordinary, I guess I should say. Medicare Advantage, low to no monthly premiums. It's kind of the inverse. So it's pay as you go, higher copays and deductibles. You can only see doctors in the plan's network, or at least that's in your best interest. You need to get prior authorizations and referrals with many plans. It's not always the case, but it's something to be prepared for. Part D drug coverage is going to be included in these plans, and again, I recommend you buy a plan with that included. Extras like dental and vision coverage are going to be included in most plans. Other perks like gym membership discounts, over-the-counter spending allowances like 20, 30, $50 per quarter for Band-Aids and vitamins and aspirin. These plans and networks usually change every year. The way I would think of it is the healthcare itself and those benefits are inferior to the Medigap option. They try to make up for it with the low or no cost for the plan itself and throwing in those extra benefits like dental and vision, which are candidly not very expensive for insurance companies to give to you for free. So bottom line, if your budget allows the Medigap option, so option one, my advice for most people is to go with that. If it becomes more expensive than you can handle or that your budget allows, then you can always move to Medicare Advantage at the annual enrollment period in the fall. Not a big deal. You can't do the opposite guaranteed anyway. If you go from Medicare Advantage to Medigap, you're going to need to answer health questions. And if you're not so healthy, then you're probably not going to be able to get a Medigap plan. But if you are healthy enough, it's something that you can usually do. All right, so that is Medigap versus Advantage. That is the most common question. It is the most consequential question, the biggest decision you need to make as far as coverage goes. So I think that's a pretty good understanding of it. The next section is costs of Medicare. Again, like we said at the outset, Medicare is not free, or at least it's not entirely free. Part A is the part that for most people is going to be no cost or free, $0 per month. If you or your spouse, so if you are a spouse who never worked or hasn't worked that much, you can use your spouse as a way to get in. If you or your spouse have worked and paid income tax in the U.S. for at least 10 years, Part A is going to be $0 a month for you. Part B, everyone pays at least something for it. The standard premium is $174.70 per month. If you have an income higher than $103,000, that's if you file taxes single, or if you're married and file taxes jointly, it's double that, $206,000. Your Part B costs are going to go up from that. And depending on how much higher than that it is, it's going to go up. So the range in 2024 is $244.60 to $594. And the calculator that I have for you that I'll show you here in a second is going to do that work for you. Medigap. If you go with a Medigap plan, that's going to range $100 to $175 a month. And that's just a ballpark estimate for someone who is turning 65. It varies widely based on your age, your zip code, your gender, whether you use tobacco or not. And if you choose a Medicare Supplement Plan G or Plan N. So there are 12 different letter plans within the Medigap family. Most of them are irrelevant. Plan G and Plan N are the ones that you need to focus on choosing between. Plan G is the most popular and the most comprehensive. Plan N is darn near the same, but it adds co-pays and one other provision that's a little too complicated to get into now. Plan N is going to be less expensive. Part D, that's going to range for the coverage itself as low as $10 a month to the national average is $55 per month in 2024. Most people are in a plan that is less expensive than that, but there are some that are more expensive, and that drags the average up. So just to be safe, I would say $20 to $30 a month. That's what I would anticipate for a Part D plan. Maybe higher, maybe lower for you, whatever is right for you. As I've mentioned before, the way to find the right Part D plan is pretty simple. You enter your drugs into a search tool like Medicare's on their website, and you choose the plan that's going to give you the lowest total cost for 12 months of having the plan itself and a year's worth of your drugs under that plan at the pharmacies that you prefer or need to use. Medicare Advantage or Part C, most of those plans are going to have a $0 monthly premium. Some do cost a little bit more, but that is what to expect, $0 a month for most Medicare Advantage plans. You do still need to pay your Part B premium to the government. Having the Medicare Advantage plan on top of that is little to no cost. So estimating your cost, just bringing this home, Option 1, Medigap, is going to be $300 to $350 a month. Again, all this goes up if your income is on the high side. Option 2 is Medicare Advantage. That's going to be about half the cost, right at that Part B expense of $174.70 per month. And I have made a calculator that will help you get your exact number, or at least your exact range, to give you a better idea. And I'll show you that here. So it's four simple questions. The first one should be pretty easy. How many years have you or your spouse worked and paid taxes in the US? 10 or more years is most people. That's the default. How did you file taxes 2 calendar years ago? Because this is how the government calculates it. It's not current year. It's looking back 2 years. Individual tax return, joint tax return. Let's say it's a joint tax return for this example. What was your annual household income in that year 2 years ago? So it's 2024 as I record this. What was it in 2022? Was it 206 or less? 206 to 258? In one of these other brackets, you get the picture. And then just again, the ballpark estimate here for the supplement in Part D. If you go that route, you get a total of $324.70 in this example. If I switch to Medicare Advantage, that goes down to that $174.70. Let me just show you if I pick just a random income bracket that's higher than this, 322 to 386, 454 and 20 cents. If I go Medicare Advantage, Medicare Supplement, it's going to be, call it 605-ish. So that is available to you. You don't need to log in or enter any information. You just click the link, it'll take you straight to this. And if at this point you want to look at specific plans, the best place to go is Medicare.gov. That's the government site for Medicare, and they have a plan comparison tool. I'll show you what it looks like very quickly. The link in the guide is going to take you straight to this, which is where you need to be. But let's say you go straight to Medicare.gov. What you want to look for is something like Find Plans Now, if you see right here, or in the header here, Health and Drug Plans, and then Find Health and Drug Plans. They move this around depending on the time of year. I wish they didn't do that, but at any rate, that's what to expect. Find Plans Now. And then you'll just punch in your zip code. It'll ask you what types of plans you want. I'll put in my home zip code of 30068. And what do you want to look for? Let's look for a Medigap policy, just for example. Find plans. And then I'll put my age in. Let's say I'm 65, male, don't use tobacco, and then update prices. And then I would ignore all these. Start with Plan G, click View Policies, and then here you go. You can see all these different quotes. So I'm not going to get into this any more than that for now, but just wanted to show you what that looks like. So this is kind of the point where if you're playing around with what it's going to cost you, do some planning, those two tools are going to get you where you need to be. The next section of the guide is when to sign up for Medicare. So this is something to pay very close attention to. I will simplify it as much as I possibly can. So just to clear the deck here, Medicare enrollment is not handled by Medicare. The Social Security Administration does it. I know that sounds a little wacky, but actually they talk to each other quite a lot when it comes to paying for Medicare coverage itself, so it does make sense. You're going to go to Social Security to sign up for Medicare. If you are already getting Social Security retirement benefits before age 65, they're going to automatically enroll you in both Part A and Part B. So that's something to be aware of. You will be notified of that if that is the case for you, and if you need to tell them to hold off and not do it, you can, but just know that's going to happen automatically. If that is not the case for you, then you need to enroll manually when you are ready to do so. Depending on your circumstances and your preferences, you may want to enroll right at age 65, and that's the right decision for many people, more and more people as the years go on, I would say. In some cases, you're going to have the choice to defer Medicare enrollment until retirement, or when your spouse retires, or you lose employer-based health insurance. Let's say you are new to Medicare at, let's say, age 65, and you are planning on retiring. That's a definite got to enroll in Medicare at age 65 situation. So that's a good example to demonstrate if you're going to enroll at 65, what are my timelines? What are my deadlines? What does this look like? So you need to enroll during something called your initial enrollment period, or IEP. You don't need to remember what that term means or anything, but just for clarification, I want to let you know what it is. It is a 7-month window of time. You've got 7 months to get this done. Your birth month is in the middle of those 7 months. So it begins 3 months before and ends 3 months after. I always recommend, if you know you're going to enroll at age 65, get it done within those 3 months before your 65th birthday, which is why in this timeline here, for an example of someone born in July, that window is going to start in April of their 65th birth year. Green is good, yellow is kind of caution, red is you're getting, close to being late. Why I recommend doing it on the front end in those 3 months before, a couple of reasons. The first is you're going to be totally safe from the risk of any late enrollment penalties, which are permanent with Medicare, not something you want to run the risk of. And if you enroll in those 3 months before, your coverage is going to start at the earliest possible date, which in this example is July 1st. So if you're going to enroll at 65, you want it to start as early as possible, which is the first of your 65th birth month. You got to get the enrollment done before your birth month in order for that to happen. If, for this example, you enroll on the later side, so sometime in July, if you do that, then your coverage is going to start at the earliest on August 1st. In August, if you enroll sometime there, your coverage is going to start September 1st, and so on. So red is kind of like a no-go. I don't recommend waiting that long. One thing to keep in mind, I need to point this out. If you were born on the first of the month, which I know is a rare case, but want to cover it. If you're born on the first of the month, you shift this timeline back by 1 month. So you've got 4 months on the front end and 2 months on the back end. And so your coverage could start also as early as June 1st, say if you were born on July 1st. So safe to say, get it done at the earliest possible opportunity. And if you're the type of person who's researching this stuff, and certainly if you've made it this far, you're that type of person anyway, get it done on the early side. If you are new to Medicare at age 65 and you are still working, or you intend to still keep your group health insurance, or your spouse does, you can defer Medicare enrollment until retirement, or you otherwise lose that group health insurance coverage. You move to part-time and lose benefit eligibility, or something unfortunate like you're laid off. You can only do that, though, if your employer or the employer you get health insurance from has 20 or more employees. So if you work for a very small employer with 19 or fewer, you cannot do this. You need to enroll at 65. But for most people in this situation, you work for a larger company, or your spouse does, and that's where you get health insurance, you can defer Medicare enrollment. That doesn't mean you should. You need to do the exercise of comparing the group coverage to your Medicare options and see what is best for you. It is your option to choose either or. It's really something that more people should take advantage of. Let's say you do decide to defer Medicare enrollment and keep your group health plan if you are able to. You need to enroll in Medicare as soon as that group coverage ends, for whatever reason, usually retirement. But COBRA is not an option for this. It's not the right decision. You need to enroll in Medicare and make the full switch to Medicare as soon as that group health insurance ends. So if you're the kind of person who needs to enroll at age 65, you can ignore the rest of this section. But if you have that option of deferring Medicare or jumping into it at 65, how do you decide between the group health plan that you have the option to keep or Medicare? So this is not an automatic thing. Again, most people assume, I think wrongfully, I'll just mess with Medicare when I retire or when my spouse retires. You're missing an opportunity to get probably better health coverage, maybe at a better cost. So here's how to think about this. The first kind of knockout, let's get this cleared up first. If you do have a spouse or children and or children who count on your group health plan as like their best option for health insurance. Let's say you have a spouse who is, a couple years from turning 65 or is younger than that. They can't get Medicare at the same time as you. Maybe the group plan is their best option to get health insurance. It may be worth it for you to stay on the group plan for their sake. Same thing with a child. Don't always assume that a group plan is their best option, though. It might be, but take a look at the individual marketplace. So healthcare.gov, which are ACA plans, they've gotten a bad rap, but in the 10 years since they've been around, they have improved drastically. So take a look. There are subsidies available, sometimes huge subsidies available for people to get coverage there. And so that's worth a look. If we pass that test and say, okay, you know what, we could take or leave the group plan, even if I've got a spouse and or kids who are currently on it, they can find arrangements elsewhere. Or if you don't have a spouse or kids to worry about, move on to the next phase of this decision, which is just comparing Medicare options to the group plan heads up. Most important factors to compare, really the only factors to compare, are what it costs for the plan itself. That's the obvious one. So how much is coming out of your paycheck for the group plan versus how much would a Medicare plan cost. And again, you can use my Medicare cost calculator to do that. So for the plan itself, who wins? Who's got the lowest deductible? The lower deductible you can have, the better. With a Medicare supplement, again, it's that $240 for the year. Drugs are in addition to that, but it's minimal. Medicare Advantage is technically zero deductible, but more heavily weighted towards copays. If there are copays on the plan, how much are they for any given service? The coinsurance. So is it 20%, 30%, 40%? The out-of-pocket maximum, which again is the worst case scenario for covered services. How much is your group plan's out-of-pocket maximum versus a Medicare supplement, which is a couple $100, versus Medicare Advantage, which can be several thousand? How is the network? Are all the doctors and hospitals and facilities and specialists that you need to see or want to see, are they in your group plan's network? Are they not? Do they accept Medicare? More than likely they do. Or are they in a strong Medicare Advantage plans network? The last thing, prior authorizations, referral requirements. Is that something that's giving you a headache with your group plan? If so, Medicare supplement is a way to solve that. Here is a quick chart for each of these factors for each of the Medicare options. So Medigap in the first column, Medicare Advantage in the second one. Just a quick reference guide. You can take your summary of benefits and coverage from your group plan or your benefit guide or wherever this information is handy. Ask your HR department or your benefits department if you don't know where it is. You can compare those numbers to this pretty quickly, and you'll get a good idea of what's going to be the strongest option. So again, just to reference the norm, the kind of the national average for group plans. If you're thinking, Medicare sounds, good, but like my group plan is great, it might be. In which case, fantastic. But the average deductible for a group plan is about $1,800 a year for one individual. A lot of plans are higher than that, upwards of $5,000. The out-of-pocket maximum is usually twice the deductible. So again, just keep in mind that Medicare is excellent coverage. And I know I sound like I'm biased just because I know Medicare. I guess I am. More people need to be doing this comparison. More people need to understand that Medicare in most cases is better than group insurance. If not for the price itself, for the network, the huge network, the flexibility you have, and the absence of headaches you're going to have with many Medicare options. It's a huge opportunity that a lot of people are just missing out on because they think, I'll just stick on my group plan until I retire. I think that's a mistake. So with that said, do the comparison. Again, if you've got family members who depend on that group coverage, it may be worth just hanging on to it for their sake. But if you have higher healthcare needs and your family doesn't have high healthcare needs and they can get coverage elsewhere, it's in your best interest to move to Medicare in a lot of cases. So let's say you decide to keep your group plan. You've done those calculations. You figured that out. Okay, got it. Medicare is great, but I'm going to hold on to group coverage for now. That's all fair. You can go ahead and enroll in Medicare Part A when you turn 65. That's not going to impact your group plan or anything. It's probably free to use, so it doesn't do any harm. It's going to act as secondary coverage to your group plan. Again, if your group is 20 or more employees. It's going to sit in the background, and it probably won't kick in while you still have group coverage, but it's there just in case. Sometimes it might kick in if something really unfortunate happens. You can enroll in Part B once you decide to ditch the group coverage or you retire, otherwise lose that group health plan. That's the point where you need to get a supplement and a Part D plan as well. You can do that ideally ahead of time before that group plan end date is. Get all those ducks in a row, get the rest of the enrollments done for Medicare so that it can start at the earliest possible date, which should be the first of the month following the end of the group coverage. So let's say your group plan is going to terminate on June 30th, for example. The ideal start date for the rest of Medicare, so Part B, the supplement, the Part D plan, would be July 1st. If you are 65, turning 65, and you decide, hey, right now I'm going to drop the group plan, I'm going to switch to Medicare because it's better for me. All you do is follow the steps at the first in the first example here. So if you are someone who has to enroll at age 65 during that 7-month window, you just follow those directions. Two things that are very important to note, regardless of what kind of decision you're going to make about group or health or Medicare. Health savings accounts, or HSAs. Note that this is not FSAs or flexible spending accounts, which is different. Health savings accounts, which are tied to high deductible health plans, and if you've got one, you know what I'm talking about. You can no longer contribute to an HSA once you are enrolled in any part of Medicare. So let's say you're going to stay on group, but you're going to enroll in just Part A for now at 65. You cannot put money into an HSA at that point. You can still use the funds in the HSA after that. No one can take it away from you. You just can't keep putting money into it once any part of Medicare is enrolled. So if you have an HSA, you want to keep contributing to it, hold off on any enrollment in Medicare if you are able to defer it. And if you have an HSA and you're okay with what's in there, or it's just been sitting for a while, you can use that money to pay for Medicare premiums. Again, the distinction is you can't keep putting money into it once you've got any part of Medicare. Second note here, and this is more of a warning. I've unfortunately helped a lot of people who have been caught in this situation. A lot of people think COBRA coverage is the right way to go when they retire or go part-time or otherwise lose active status and lose their group health insurance. COBRA, if you're not familiar, is basically the option to continue your group health insurance once you leave the employer or move to part-time or are no longer active with that group as far as health insurance coverage goes. You're going to have to pay for it. Sometimes companies will pay for it for you, but at any rate, it's a way for you to keep that group coverage for up to 180 days. Some people think, well, I'll just get COBRA, especially if my old employer is going to pay for some of it or all of it. And then once COBRA goes away or is exhausted, then I'll worry about Medicare. That is not something to do. You need to enroll in Medicare if you are 65 or older. You need to enroll in Medicare the minute your group health insurance goes away, your active group health insurance goes away. So if you're in the situation of needing to decide on COBRA, that's probably you. If you're 65 or older, you got to enroll in Medicare. It doesn't make sense to get COBRA and have Medicare, but it's technically possible. What I would say is that a full-on Medicare option like the two options we've been discussing is going to be better anyway. It's going to be less expensive, but technically COBRA and Medicare will work together. The pitfall is if you elect COBRA and you don't do anything with Medicare, then what the Cobra plan is going to think is they are secondary coverage. So there's a primary slot and a secondary slot. Cobra plans will expect Medicare to be the primary health insurance. And if you haven't enrolled in Medicare, that slot is empty. And so if there's a claim, you as the individual are going to be paying the bill before Cobra would kick in. So that's a huge pitfall. Do not fall for that, please. I know I'm kind of belaboring this point, but it's important because a lot of people fall into this trap, and it's a very expensive trap. The next section is how to sign up for Medicare. So you've decided, or at least you have a good idea of when to sign up. How do you actually do the signing up? So there are two ways to do it, online or by phone. Online, doing Medicare enrollment is really, really simple. It's very easy. It takes maybe 10, 15 minutes. So again, Social Security is where to do it. I'll show you what the link looks like, and I've got this here. You can click on it. Or if you just Google sign up for Medicare, just click on the Social Security's link. That'll probably be the first result. You'll be taken to this page. So sign up for Medicare. If you're going Part A, Part B, jumping full on into Medicare at age 65, this first link is for you. If you have already signed up for Part A and it's years later or sometime later and you just need to get Part B, there's a separate link for that. But let's say I'm just doing this first link here. I'll click apply online. I can't get much farther than this, but I'll just show you what this page looks like. So you agree to that consent, click next, and then this link down here, start a new application. And then answer a few questions, you're good to go. So I can't show you much more than that just because I don't have a valid bit of information for somebody who's actually ready to enroll. Just something to be aware of. If you don't have a My Social Security account, which is their name for like your login for Social Security's website, you're going to need to create one first before you go to the Medicare application itself. It routes you back. It's pretty simple. There's more info on this link if you want to dive in, but again, the link that I just showed you, it'll kick you over to it automatically. And I know it's a pain to just handle, even more logins, but this is important. It's a one-time deal. Just get it taken care of. That's my advice. If you want to enroll over the phone, you technically can. They even used to let you go to the Social Security office in your county, but they are no longer doing that. So if you don't want to do it online by yourself, doing it by phone is your only other option. You can call Social Security at this number here and tell the representative you want to sign up for Medicare, whether it's Part A and Part B or Part A only or Part B only, whatever your situation is. I would not expect to get the enrollment done on that first call. Usually they will require you to schedule an appointment for a later date where a representative will call you at that time and get the enrollment done then. So it's not going to be a one-shot deal. At least I haven't heard that as a possibility. Usually it's got to sign up for another time. So that is an overview of those options. The info that you need when you sign up is pretty simple. Your Social Security number and where you were born. That's pretty much what they ask you. If you are enrolling after age 65, it's going to ask you for start and end dates of any current group health insurance plan. So get that from your HR department if you don't know what that is. And then if you're just doing Part B only, you need a valid email address. That's with anything, actually. Your existing Medicare number, if you've already got Part A, you've already got an ID card. You just need to add Part B to it, and you're going to have that number. And then here's a link to check the status of your application once you have submitted it. Again, these are all on Social Security's website. I just liked to stick it in here for quick reference. Once you've signed up for Part A and or Part B with the government, if you'll remember just kind of how we've built our understanding here, that is the baseline coverage. That's kind of your entryway into the rest of the coverage. You need Part A and Part B to shop for anything else. How do you sign up for a Medigap plan, a Part D plan, a Medicare Advantage plan? So these are all sold by private insurance companies. So we've broken away from the government, at least for these types of plans, as far as how you enroll in them and who you buy them from. You can buy them directly from the company, and they'll take your business, go on their website, call them up, what have you. But you can also use a broker. And the benefit of that is simply a broker. And again, I'm biased because I am one. I am contracted with every major insurance company that sells these plans, so I can compare them all. I can give you a look at the entire market. If you go straight to an insurance company, they're just going to be restricted to talking about their plans, their prices. Evaluating the whole market is the smart thing to do. You can do that on your own with Medicare's Plan Finder, which we've taken a little preview of, but you can also use a broker like me. It doesn't cost you anything extra to use a broker. My compensation is built into the price of the plan, and your price doesn't go up because you use a broker. It's a marketing and advertising expense on the insurance company side. So if you go directly to them, they're going to pay some in-house sales agent with that share of the premium. If you go through a broker like me, they're going to pay me in the form of a commission for that. So point blank, you don't pay anything to a broker. They actually cannot charge you, and you don't pay anything extra for your plan by using a broker. And then last little value proposition of any good broker anyway is it's in their best interest to keep you happy and keep you as a client. That way they still get paid. So they're going to be available to answer any questions you have that maybe the insurance company can't or is giving you a tough time with. And they're going to make sure that you are in the right plan for your needs every year. Again, keeping you happy as a client is the way they earn a living. It's the way I earn a living. And so as far as the plan they suggest for you, they shouldn't really be too biased about companies because they all pay about the same commission. It's worth more from a business perspective for a broker to keep you happy no matter the plan, no matter the company, as long as it is the right one for you. A word of warning here. Medicare's Plan Finder, that Medicare.gov link, which I've got again right here, is the only safe place online to get quotes. If you get a quote from anywhere else online, it is tied to a marketing organization, usually a huge call center who is hell-bent on aggressive sales tactics to win your business. There's nothing inherently wrong with that, but just know that that's what you're signing up for. They're going to get your information, and they're going to bother you to high heaven. They will not let you alone. So just something to be aware of. If you find a good independent broker, I like to think I am one, you will be safe from that as well. But as far as looking on your own online, Medicare.gov is the only place I recommend going to look at quotes. Let's quickly discuss other coverage. So this is stuff that naturally kind of bundles into health insurance, but is not technically part of Medicare, and you need to account for separate from Medicare. So dental and vision coverage is the first one to think about. If you opt for a Medicare Advantage plan, again, it's most likely going to be included in some form. It's not going to be the best coverage in the world, but it's going to be something. If you opt for Medigap, you're going to need to buy this coverage on your own if you want it. Dental coverage starts at about $40 a month. Vision coverage starts at about $10, $15 a month. So conservatively, let's say $50, $55 a month is a starting point for standalone dental and vision coverage. If you use those preventive benefits of those plans, like you go to dentist twice a year to get your cleanings and x-rays and dental exams, and you go to the eye doctor, you get your eye exam, you use the frames allowance, you use the lenses allowance every year, plans like this are going to pay for itself, but only if you use it. And then, of course, on top of that, more on the dental side, it's going to have more of a benefit there if you need a crown or a cavity filling, something of that nature. Cancer, heart attack, and stroke insurance. So these have become a lot more popular in the last couple of years in the Medicare market. They're very popular among the employer market. So if you've got group health insurance, you've probably seen something like this. Basically, the way these work is if you're diagnosed with a covered disease or health event like cancer, heart attack, stroke, something serious like that, they will pay you a lump sum benefit, usually anywhere from $5,000 to $30,000 in coverage. again, upon diagnosis, they just write you the check. You can use the money as you see fit. Of course, they're designed to offset your out-of-pocket medical expenses. So like a Medicare Advantage plan with a $7,000, $8,000 out-of-pocket exposure, if you are diagnosed with something like this, you're going to hit that. Having a plan like this will help offset that. But also, your bills don't stop just because you got sick, right? So you can use the money to pay your mortgage, your rent, groceries. If you want to fly family in and cover it for them to come visit you, you can use the money for that. Again, whatever you'd like. Cost is roughly $15 a month per $5,000 in benefits. And like I said, in most cases, you can go up to about $30,000 in coverage. Life insurance. If you don't already have life insurance and you need it or want it, while you're already talking about these health insurance needs, now's a good time to just cover off the need if you need it. Why you might need life insurance in the later stages of life really is to cover end-of-life expenses for most people. So like funeral, final arrangements, if you have some outstanding debt that you don't want to pass on to your family, or you want to leave a little something for your family. You can get a relatively small policy for, usually couple $100 a month for those purposes. Another way to use life insurance in the later stages of life is to cover off long-term care expenses, because as the next topic here is long-term care insurance. Traditional long-term care insurance is super, super expensive. Some people still see the value in it and still buy it, which is great. But for a lot of people, it's a lot, a couple $100 a month at least for enough coverage. So to give you an idea, the average annual cost of a private room in a long-term care facility is about $100,000 a year. And again, that goes up every year with inflation, just like everything else. A semi-private room's a little less expensive, like $80,000 to $90,000 a year, but it's still a lot of money. The average stay in a long-term care facility is about 3 years. Men stay less than women. Women stay longer than that 3-year average. So anyway, you need, if you want to cover off everything, $300,000 in benefits is kind of the safe bet. Now you can go less, you can go more, but just based on that math, 3 years times 100 a year, 300 is appropriate. So traditional long-term care, that's going to be expensive. Usually about $500 a month per person for that. If that's outside your budget, which I understand, you can consider short-term care insurance, which will cover up to a year. You can configure plans to cover up to 90 days, up to 180 days, 360 days. The cost will go up with that, obviously. You can get coverage up to $200, $300, $400 per day for a maximum, like I said, of 360 days. Cost for that is much less than traditional long-term care, $75 to $150 for a robust plan, not kind of a bare bones plan. And then a third option is buying a whole life or a permanent life insurance plan with a long-term care rider on it, which basically eats into the death benefit to a degree if you do need long-term care. So that is, a lot of people ask me about long-term care. I'm not trying to push anything. I just want to cover what the actual costs are and what the options are to insure against it. All right, so with that, let's get into the frequently asked questions that are kind of left over after we've gone over everything. So a really common question and concern is worry about late enrollment penalties, because you hear about it. A lot of marketers really push it as a reason for you to call them. And they are permanent with Medicare, so it's kind of scary. If you have followed this guide and you understand everything in it, you are safe from any risk of a late enrollment penalty. I'm sure of that. If you just act on the early side, again, if you're going to enroll at age 65, do it 3 months before your 65th birthday. Do it at the earliest opportunity. If you get your group health insurance from a large employer, again, that's 20 or more employees, you can do it as late as 60 days. That's my recommendation after the group coverage ends. But again, do it on the early side. You can do it up to a couple of months before you know that group health insurance is going to end. So get ahead of it so that Medicare can start at the earliest possible date. Again, if you've paid attention to this, you've read this guide, you've done any other research online, you're the type of person to understand this, and you're not going to be at the risk of a late enrollment penalty. What's the deal with all these ads? The Joe Namath ads, the JJ Walker ads that are claiming all these free benefits and money back on your Social Security check. What is that all about? Well, it probably smells like BS to you. It is, frankly, BS. It is technically advertising a certain type of Medicare Advantage plan called a give back plan, which is totally legal. They are on the market. They are available. And it is true, if you enroll in them, many of them do give back some of that Medicare Part B premium, sometimes all of it. But you get what you pay for. If you take a look at one of those plans versus, say, a competitive Medicare Advantage plan, just comparing apples to apples, you're going to find that the give back plan is stripped of a lot of benefits. And the networks are tiny, high copays, high coinsurance, high out-of-pocket maximum, just not a good quality health insurance product. I don't recommend touching them or even thinking about it. Now, I know a lot of people, that $174 a month, that's a lot of money. And, this might be appropriate for them if they're okay with trading in some benefits as a result. It's a weaker plan. And quite frankly, the whole point of all this is to ensure your health as best as possible. If you strip that away, you're kind of defeating the purpose. Same goes with the plans that they advertise that have all this extra free stuff, like, even the over-the-counter benefits. I mean, that's nice to have, but don't make your plan decision based on the free stuff, because it is very cheap, darn near free for an insurance company to give you that stuff and gladly offload some of the risks, some of the benefits. It makes it much more profitable for them. The next question, I get this a lot. I don't take any medications. Do I really need Part D coverage? So I get that, and it may seem like an added expense that's not really necessary if you don't take any drugs, but two reasons you need it anyway. The first is the government is going to expect you to have this coverage when you're in Medicare. So when you have Part B, you fully activated Medicare, you're expected to have Part D coverage. If you go without it, let's say a couple years pass by and you then decide you need Part D coverage, you're going to pay a late enrollment penalty for that forever. It's not a huge penalty, but it is something, and it's nice to avoid that. The second reason is kind of the obvious one. You may be really healthy, which is awesome, but things do happen, things do change. If you need to start a drug, specifically a name brand one or a specialty drug, or a lot of chemotherapy drugs these days are prescription based, and you don't have coverage for that, it's going to be really unfortunate for you financially. Having some sort of coverage is the smart thing to do. And again, a lot of Part D plans, most Medicare Advantage plans do include Part D coverage at that $0 a month premium. If you need to buy it standalone because you're going the Medigap route, plans start at around $10-15 a month. So nothing too crazy. Next question, is Medicare in danger of going away, or are they going to raise the age from 65 to 67 or something like that? I don't think so, at least not in the coming 15, 20, 30 years. Medicare is a huge program. It is one of the nation's biggest expenses after the military. There are too many people dependent on it. It is a big issue with voters. So if a politician, I'm just saying it like it is, if a politician wants to mess with Medicare, they're going to lose a lot of votes. What's more, insurance companies and drug makers and big healthcare conglomerates, big hospital systems, they are far too invested in Medicare, and quite frankly, they make too much money off of Medicare, and their influence is too powerful in Washington for them to allow Medicare to strip anything away or significantly change the program. They have the most lobbying dollars and the most lobbying power in the country, and so they're going to make sure Medicare isn't going anywhere. And I think that's a good thing. For older Americans, health expenses are going to be the biggest expenses they encounter. And so having robust health insurance like Medicare is a good thing. There'll be slight tweaks to it as the years go on. That's just normal, like any other health insurance or like any other product that is regulated. But the existence of the program is not at risk. Last question. I get this a lot when people get to the stage of working with a broker like me. They ask me, what's in it for me? What's my incentive to help somebody? How do I get paid? So I touched on this a little bit earlier, but basically, if you buy an insurance plan through an insurance broker, which is what I am, they get a commission from the insurance company that you happen to choose a plan from if they are licensed and contracted to work with that insurance company and sell their policies. And a good broker will have contracts with most, if not all, of the big companies in the market. That commission is built into the premium of the plan. So when an insurance company prices a product, let's say their Medicare supplement is $150 a month, just giving an easy example here, there's usually about 20% of that cost, so about $30 of that in this example, that they will budget internally for marketing and advertising and distribution. If you go directly to the insurance company and buy it from them, they will chalk up those $30 per month to the marketing and advertising expenses or the in-house sales team that sold you the policy. If you use a broker like me and I bring them the business, they take that 20%, that $30 a month, and give it to me as a commission. So I hope that makes sense. Your price does not change because you went to me versus directly to the insurance company. So that's how brokers work. That's how brokers get paid. And again, it is in a broker's best interest to keep you as a client. So some brokers will push product and maybe go for an insurance company that may pay a little bit more in commission, but that tends to come full circle if the plan isn't in the individual's best interest. They can very well leave, find another broker who will treat them better, and they'll lose that business. So it doesn't make sense for a broker to be so short-sighted, at least in my opinion. So that is the extent of the guide, I'd say. I hope that was helpful. If you have any questions or you would like one-on-one help from me, you can do that. The best way to do that is to schedule an appointment. Here is a link. It's at the bottom of every page on the guide. This is my website. That link, stromaninsurance.com/appointment, will take you directly to my calendar where you can book a time to speak with me. And again, my services are no charge. So if you are interested in Medicare, you're close to enrollment, you need to make a decision, or you need to enroll in a plan, that's the best time to reach out. So I hope this has been helpful. Again, this is my vocation. I love doing this stuff. I love helping people. If you've got feedback, let me know. If I can help you one-on-one, would love to do that. I work with people in all 50 states. So anyway, that was it. It's been a pleasure, and talk to you soon. Hope the best for you.